so excuse that. We're going to do things in the dark here, because that's what we do when we're concussed. That's the first thing that we're told usually, is to sit in a quiet room in the dark and try and shut everything out. But we're not going to do that here this morning. Not all of it anyways. I just went to the bathroom and that was a little bit difficult as a man in the dark. I recommend that if you need to go to the bathroom, man, sit down. Everybody will appreciate it. I'm going to open with a song. This is an unexpected turn of events, and as was my injury. And my injury is highlighted in the second verse of this song. It's about being grateful for what you have. You don't know what you've got till it's gone. Oh, I know you don't want to hold on anymore. You don't know what you've got till it's gone. No, then it's gone. It's gone. It's gone. My wife had a friend before we were wed. It was her best friend in the world. Then one night by the fire, some flames got too high. We never did see her again. Best friends in the world since they were just little girls. A friend infinitely was missed. She never got over the miss of that shoulder. 4 years of emptiness. You don't know what you've got till it's gone. Oh, I know you don't want to hold on anymore. You don't know what you've got till it's gone. No, then it's gone. It's gone. It's gone. Control all the things that go on. You don't know what you've got till it's gone. No, then it's gone. It's gone. It's gone. I once was a carpenter, and I was much more active. A couple of things that I took for granted. Then all of a sudden, my bell was rung, and I never was ever the same. No, life it is short. Control's an illusion. You cannot control all the things that go on. So live in the moment, no moment to lose. This moment, it belongs to you. You don't know what you've got till it's gone. You cannot control all the things that go on. You don't know what you've got till it's gone. No, then it's gone. It's gone. It's gone. You don't know what you've got till it's gone. Oh, I know you don't want to hold on anymore. You don't know what you've got till it's gone. No, then it's gone. It's gone. It's gone. It's gone. Then it's gone. Then it's gone. Quiet. One hands. A lot of us, as a performing musician, that is often the hardest part for me, is the applause. Music is actually quite healing for me, and we have one of our guest speakers who will talk more about that. Right now, I want to introduce one of my former bandmates, and a good friend of mine, Carl Ross. He's going to be presenting intuitive and easy to apply concepts that will help you feel confident when healing from brain injuries and post-injury symptoms. Typically, conditions and symptoms related to TBI and ABI are difficult to treat using our current medical system, which is why it can be helpful to learn more about holistic and alternative concepts. let's take this chance to explore the relationship between your physical, mental, emotional body and how you can find happiness after experiencing mental and emotional trauma from a physical accident. Carl Ross.
Thanks.
So I'm Carl Ross. My partner is Alicia, and we were going to live stream the event, but we're out of power right now. But we're still going to get away with some recording. It's just not going to be as nice, but we're going to do our best. And both of us are students of pranic healing, and we're just starting to practice, and I'm going to talk about that in a second. So I would like to introduce some concepts, and they're going to be quite simple because I am not a specialist in this area, but that's why I'm kind of opening to just warm us up to some, I call it the fundamental principles behind healing. And so this is not just going to apply to TBI, but it's going to apply to how you can approach healing any ailment. But specifically, we're going to focus on ailments that are a little bit difficult to treat with our current medical system. And why it's like that, and some ways we can approach it. And so I'm just going to be giving some strategies. And then I'm going to be talking a little bit about trauma and how a pranic healer looks at trauma and how we might approach healing that. So, and of course I understand that when you have an ailment, you need to go see a specialist. But from my perspective, that should be our second priority, because the first priority should be understanding the fundamental principles behind healing first. So a lot of people will go run after the specialist first and get that, but then they won't be taking care of the basics. And that's something that we all have control over, and it's free. So I always like to start there first, and once we can get on that page, then we can move on to talking about more of the specifics, which is gonna, I'm sure there's quite a few people that know a lot more about the brain than I do. So the very first fundamental principle of healing is the law of self-recovery. It's that the body always wants to heal itself. Our body is designed to heal itself. And so when it's not doing that, then we have to start thinking like, kind of what's getting in the way, because we are designed to heal. And we also, a big part of this is believing that health and healing is possible, because that's what our bodies want to do. So just being aware of that is the first part. And a lot of people will go through a large period of time of suffering from symptoms, and they say that they are ready and that they think that they can, but there's still that doubt that's sitting in the back of the mind that, oh, maybe I can't, maybe this is it for me, maybe this is over. And that's the very first thing I would want to eliminate, so that we can move past that and get to the next steps. The second fundamental principle is having realistic expectations. So how healthy do you need to be? And the way you're envisioning, like let's say you're not that healthy right now, but you're like, okay, I'm going to be this healthy in a couple of years. But how healthy is that? Like, is it even realistic? Is that even a realistic goal to have? And the next question is, how healthy do you need to be happy? Do you need to be like a 23-year-old Olympic athlete? Do you need to have a certain appearance? Do you need to have a certain mental ability? Or are you going to be able to be happy before you reach such high standards? Because a lot of people have a vision for health in their mind that's, they might not even need that to be happy, and all we really want to do is to be happy. So this is the next area that I would want to discuss with the client to go through, because if the expectations are off, then we have nowhere to go, because we're still confused in these early stages of the healing process. The third fundamental principle is the body's hierarchy of needs, which all of you guys are going to know. I'm sure we all learned it throughout our youth, and if not, at some point, because all of us have been sick and have had to heal from something. And so this comes in order of priority, because our body prioritizes these, and I call them the 7 daily essential nutrients. So the first one's oxygen, water, it's 2. Rest and sleep, not just sleep, but rest. 4 is food, 5 is relationships, 6 is nature, and 7 is movement, exercise. And so, by the way, I do have this printed out, and I don't know, maybe I can send out this copy, or you guys can talk to me after if you're interested in the notes, because I kind of write out these little scripts for this. With difficult conditions like TBI, let's say you're just had an injury, or you're suffering, you're having a migraine, or having some of these old symptoms come back up and you're immobile, then what you're going to want to do is prioritize the first three. So, which is oxygen, water, rest, and sleep. Okay, so most people know all these fundamental pillars of health and healing, because we all do this all the time. I'm sure most of you guys have eaten today. But what we don't know is the priority. And it's very, very serious, because then we have order. And when we have order, we have progress. And when we have progress, we have healing. So we just want to have that structure in our mind so that we're not getting confused, because when you're sick and you're in pain, it can be overwhelming. And so what I'm trying to do is simplify things, right? So believe that you can heal, have realistic expectations, and prioritize your nutrients and make sure you're getting the highest quality of each of these. It's going to look different for everyone. My high quality food will be different than your high quality food. But this is just for personal exploration. And the last thing before we move on to the mental and emotional is the two factors that control physical healing. So the first one is the quality of your blood. And this applies to all physical healing. Like, I'm talking broken bones, broken skull, anything. If you want to heal your physical body, you need two things happening. And I don't want to oversimplify this to make any confusion. What I'm just trying to do is make it easy so that when you're stressed, you're not going to freak out and just be like, it's a write-off. I'm done. Or I'll just try again tomorrow if this day is over. So what we want to do is just try and simplify things. So the first step is the quality of your blood, okay? This is where all your nutrients are, and this is what you need to replenish your body. And two is the quantity of blood you can get to that area. So you need good quality blood, and you need blood to be flowing to that area. And that's the basics for any physical healing. And so how do you clean your blood? Well, you remove the toxins and impurities, and you add in clean nutrients. And then, of course, we know how to do our physio and exercise to make sure that blood is flowing through the body so those nutrients can get to the area. And this may not be a case if you've already damaged the head area, because it's so sensitive. But for those of us who haven't, or who are ready, if we're working with a specialist, a physio, and we have that approval, getting ourselves upside down and to make sure that the blood does flow to that area will also increase our brain health later on in life. Because many people's brains start to decline, and most of us are vertical or horizontal. We're not the opposite of vertical, even just for a few seconds. And this within reason. I don't want anyone to hurt themselves, but these are just concepts to think about, because so that we can understand our situation better. So our medical system is great. I've used it. I wouldn't be here if I didn't have it. I would have died, because our medical system provides excellent solutions for physical problems. And I know there are exceptions to this, but it's just something to keep in mind. If there is a physical problem, there's usually a clear answer. Maybe the answer is we don't have the technology yet, but usually there's a clear answer. But from my experience, working with some people that are not working, but talking with some people that are having TBI symptoms, they're not able to get clear answers on how to move forward and progress. And so as soon as this comes up for me, and this also goes with other conditions that people are like, I don't know how to solve this. So as soon as that happens, I'm like, it's probably a mental and emotional problem. We do have tactics to fix these, but from my perspective, we're not as advanced in this area. And a lot of times people will just take the pills to change the hormones or the chemicals in the brain to alter the mind, alter the emotions. And this has a temporary effect. And for long-term effects, if someone was having trauma, and for them to recover is like really impressive. And a lot of times we don't get clear answers in this area. So I'm just saying this to maybe save a bit of time if you want to be looking for the right answers in the right places. So a lot of times we're going to be pushing to go get, okay, I just need this thing to be tweaked. I just need to be a bit better aligned, or there's something happens, I need a surgery, I need something here to make me align better physically. And we may do that for several years and spend a lot of money and time doing that, and at the end of it, we're still having these symptoms come up. As soon as we have a bad day, the head hurts, right? And so we're going to be just diving into that here, talking a little bit more about that. Yeah, and as soon as I hear the word traumatic brain injury, I'm just thinking mental and emotional trauma. And that's a huge, huge part of this puzzle, and this is a hard piece to tackle. So this is why Alicia and I study chronic healing, because we've been able to get some answers for ourselves in this area. And so from a chronic healing perspective, this is the only way we've been able to get answers, because we don't have necessarily technology to accurately measure thoughts and emotions and how they affect our health and well-being. But for example, if we're having our head and it's hurting and we're not able to get relief, we've tried everything physical, we're out of options, and we're like, hey, why is it still hurting? From a chronic healing perspective, inside the energy body, there may be some denser and grosser energies from the past, from the trauma of the accident, that have been stuck somewhere in the energy body, maybe in this case, more in the head area. Okay? And if we're going to experience that release of pressure so we can feel, and so we can have things flowing better in our heads, so we can make that healing process happen that already wants to happen, then we're going to need to remove those energies. And you can do this through counseling, and it happens slowly over time. But there's also other methods. With an advanced energy healer, you can extract those emotional and mental energies out, and you can replace them with clean energies. And this is sort of just the basic fundamental principles. And this is also just to give you hope and provide other options, because sometimes a conventional option, like several years of counseling, may be slow and inefficient. Maybe you want to have results a bit faster. And so this is kind of how trauma would be treated. And it's kind of very similar to physical healing. And that's why, even though we can have mental and emotional trauma, we can still feel physical pain. So we have to get that high quality blood, and we need that blood to be flowing. Okay, the same is with our energy body. We need high quality energy, and we need it to be flowing. Okay, and this is what we have difficult treating, especially for PTSD and things like this. So now, for severe cases, if there's a lot of trauma and it's a very difficult case, then having a few multiple advanced healers work with you for a period of time is going to be the fastest way. But it also, if you can't, when you're dealing with the trauma and the mental and emotional side of things, it can be very difficult as the client. So usually, it does have to take a while. But for simple cases, you can definitely do this yourself, and it's free. So one is following the fundamental principles of healing. Make sure you have those basics down, or else we're not going to be able to deal with the specifics later on for the case. And being conscious of your mind and your emotions, making sure you're providing a clean source of energy. And so that's just positive thinking and positive emotions. If you can have that going on up here, and then all we need to do is extract the grosser, denser energies and replace it with the clean energies, and then we have this thing that we call, I'm healed. I feel better. And so you can do that on your own, through your own process. Just make sure you're aware that you're not tossing up anything like, why did I do that? Or like, I can't believe I haven't healed yet. Why isn't it time? Like, is it going to be like this forever? Because then we start getting in that area, right? And then we're not going to be able to move on. And then the last one is just learning the basics of chronic healing, if it is on the mental and emotional side. And I'm sure we're going to have people speak more on the physical side to cover that. So that's my presentation, and we can talk after.
Thank you. Thank you, Carl. Good job. Yeah. was a very well put together presentation, Carl. Thank you for being here.
Yeah.
And I just want to add to it, I was told, I've been suffering, I was concussed over 7 years ago, and I've been on my own journey pretty much. It's a tough journey to battle on your own, and I had to find all these different people who have helped me along the way. I've went out and I sought all these different treatment options on my own, and part of the reason we're doing this here is so that you can learn about them in a much simpler way than I had to. But something I would like to touch on from Carl too is my OT. When I did a little bit of a rehabilitation thing that WCB put me through in the early stages, and my OT told me something. She said when she was discharging me, she knew that it wasn't right for me to leave at the time. There's some politics involved. They just wanted me to get back to work, and she knew that I wasn't ready. But she told me one thing that I didn't really understand until recently. It's that you are in control of your own healing. And it's something that Carl put together pretty nicely for us. It's ultimately up to you. Everybody that you go and see are going to help guide you, and they're going to do things for you that help. But ultimately, it starts at ground zero, which is yourself. I'm rambling a little bit, and I should have been a little bit more prepared. That's okay. I'm going to introduce our next speaker, Selena Wong, and she's with the Flower of Life Integrative Health. And she's going to talk about cannabis and how cannabinoids can help our endo and cannabinoid systems. So, Selena Wong.
You can feel the excitement in the room. Cannabis. So for those of you who don't know me, my name is Selena Wong, and I work for, and I've created, the Flower of Life Integrative Health Center with my business partner, Stephen, who's back there to say hello. I'm a cannabis healthcare consultant, as is my business partner, Stephen. Stephen focuses on the animal aspects, and I focus primarily on pain and trauma. So this is kind of interesting to be able to present to you today. I did have a really fancy PowerPoint all ready to go, but I'm going to save the dry science, and we're just going to have a conversation if that's all right. For those of you who don't know me, a little bit about my history is I actually was in a really bad car accident in 2003 that nearly took my life. I was 18 years old, and I did sustain some really severe traumatic brain injuries, and it took a long time for me to recover, and I'd say that I'm still in recovery. But what I can say is that when I found cannabis and when I started using it as a medicine instead of as a tool to escape my feelings, it actually became one of my best allies in healing, and that's something that I want to share with you today. So for those of you who want to participate with me, what is cannabis? What is it?
It's grown.
It's a healing plant? It's pardon?
Nothing.
So it's a healing plant.
It's a herb.
It's a herb, absolutely. It's also a sacred plant medicine. This medicine has been around for a very long time, since the beginning of our time as mammals, and it's actually a very safe and gentle product to use if you know how to use it properly. It's a plant. It's food. So who here eats hemp hearts? Yay, you're eating cannabis. Yay, lots of nutrition there. It's also fuel. Who here has heard of, well, it's fuel, it's also fiber. Who here has heard of hempcrete houses? Yeah, very cool, very innovative technology coming forward. It's a medicine like we're going to be talking about today, and it's also a sacrament, so it's something that people are using for religious purposes. Cannabis has over 110 different compounds called cannabinoids. Who here has heard of THC? So that's the stuff that gets you high. Who's heard of CBD? Awesome. Who here has heard of terpenes? Okay, some of you. So terpenes are the flavor and smell profile of the plant, and those also have modulating effects on healing. So they actually help the THC and CBD become absorbed in the body better, which is really great. So if you think about the smell, think about lemons. Can you guys think about the smell of lemons right now? That citrusy note? So that's a terpene called limonene. And for mood, it actually makes you happy. So when we have a cannabis cultivar or a strain, we call them cultivars, what you'll notice is that when you have something with a lemon smell, for example, it'll boost your mood. When you have something that smells like lavender, it'll help to relax your nervous system. So as we continue with the conversation, you'll see why I'm bringing this up. So we did mention THC. So THC primarily acts on pain, it helps with sleep, it helps with nausea, and also with stimulating appetite. It causes the high, or what we call in our organization a euphoria. When we have too much THC, we have what's called dysphoria. Sometimes it can be as simple as laughing and being hungry with the euphoric sense. Sometimes it can be really uncomfortable where we're feeling anxious or a little bit overwhelmed, or sometimes sluggish if we've had too much. But with THC and CBD and all the other cannabinoids, I need to make it perfectly clear that you cannot die from using cannabis. We actually have an endocannabinoid system in our body, as you're mentioning. So it's a system that's meant to absorb cannabis in your body. So the endocannabinoid system, it has receptor sites all over the body except for the back of the brain. And that's responsible for breathing. So it actually can't stop you from living. Even if you've had too much, it might be really uncomfortable. It might take a few days to recover, or even a week, depending on how much you've had. But you will live to tell the tale, as they say, and you'll be okay. CBD, on the other hand, is what a lot of people know as an antipsychotic form of cannabinoid or cannabis medicine. It actually helps to counteract the THC high. So when we use the CBD in conjunction with THC as a whole plant medicine, we actually get to sidestep all of those adverse effects that I was talking about, which is really cool. CBD, when we talk about traumatic brain injury, is actually one of the leading cannabinoids that people are really driving towards because it is a neuroprotectant and actually can help with neurogenesis over time. CBD is also really great for epilepsy. So if you think about CBD getting its famous name, or its famous, how do I say this, Stephen? I'm floundering because I'm a little bit nervous. I apologize, and it's pretty hot up here, and I'm a little sweaty. I apologize. But CBD can actually counteract the high of THC, and it's known to help primarily children with epilepsy. So when we think about tremors or triggers like that, it can actually help to reduce the tremors. Great for anxiety. I think I need a little bit of CBD right now, to be honest. Just saying. It's also an antioxidant, which is really important when we're talking about traumatic brain injury, because oftentimes when we have a brain injury, what will happen is your body will oxidize. And when we have CBD introduced into the system, it'll actually produce an antioxidant effect, and it'll help to reduce those free radicals in the system and help with healing. It's also an inflammatory, and depending on the type of pain, it may help to reduce pain. Now, we think about THC and CBD as these independent things, but there was this really great study that came out years ago by Dr. Ethan Russo called Taming THC, the Entourage Effect. And what they found is that THC and CBD, when we're paired together, as well as the terpene profile, so the natural profile in the plant, when we do a whole plant extraction, it actually works so much better than when we have an isolated compound or a THC-free product. Now, I had some dry science I was going to show you, but I'll just show you the paper. And if anybody wants any of this information, please email me. I've got cards at the end, and I'd love to have some one-on-one chats. And here's the endocannabinoid system. So we have CB1 and CB2 receptor sites. CB1 is your central nervous system, and it has a lot to do with the brain. CB2 receptor sites have more to do with your organs. But in order for the CBD to cross a blood-brain barrier, we need THC. So that's why these compounds work better together. So there's different kinds of cannabis products that are available. Can anybody tell me about something other than smoking? How can you take cannabis?
Vaping.
Vaping, absolutely. What else?
Tinctures.
Tinctures, yeah.
Gummies.
Gummies, yes, that's on my list. Salve, absolutely. Cooking with it, definitely. How about suppositories? Has anybody heard of that? You can actually insert cannabis, a high THC cannabis, into the rectum or vaginally, and you can actually get a lot of pain management without the high, which is really interesting because what we're doing is we're bypassing the liver, which breaks down the THC, and it's a direct hit to the bloodstream, which is really wonderful for people with acute pain issues. The other thing that I wanted to mention is that when we pair THC with CBD at an even ratio, because CBD is that antipsychotic, or it takes down the high of the THC, we're actually able to get the full medicinal benefit of the THC without the high. So all of a sudden we're able to introduce these cannabinoids in a way where you're functioning. You're not sleeping all the time, you're not eating, yourself out of house and home, which is great. The other thing that I wanted to mention is this idea of cannabis cultivars. So I mentioned that we use the term cultivars instead of strains, and there's a really important reason why. Unfortunately, in the cannabis industry, there's a lot of misnomers, a lot of language issues, but strains really have to do with bacteria and viruses, and cultivars have to do with agriculture, and that's what we're talking about here. We're talking about plants. So just something to know about. So we've heard of sativa, indica, hybrid. Sativa now is being termed as a narrow leaf cultivar. It's like your tall, spindly tree types. Your indicas are your short, stumpy, broadleaf cultivars. You've got hybrids, which are what most of the cannabis plants are these days, and this idea of ruderalis, which is hemp. And the only difference really between hemp and cannabis is that they've bred hemp to contain less than 0.3% THC, so it can cross a border. But hemp is cannabis. Surprise, all of you that are eating those hemp hearts. So we did talk about the different ways that you can use cannabis. You can smoke it, you can vaporize it, you can orally ingest it. There's topical applications, so the salve, absolutely, and insertion, like I was mentioning with suppositories. When you're looking at using cannabis without the high, there are certain products that I would steer you towards and certain ones that I'd steer you away. The ones that I'd steer you towards would be the topical lotions, would be suppositories, would be orally ingesting a higher CBD profile than THC. That's always really beneficial. And just for those of you who are a little bit novice and a little bit afraid to use THC, just know that if you have too much THC again and you use CBD with it, you can actually bring down the high of the THC and bring yourself back into a more comfortable state. So who uses cannabis? I'm not asking, okay, well, if you want to put your hands up, I know I definitely do. Awesome. A lot of people do. As of September 2008, 300,042 Canadians were registered under Health Canada's Access to Medical Cannabis for Purposes Regulations program, the ACMPR. And chronic pain is actually the most common reason. And what we see with recreational cannabis is that 22% of Canadians reported using cannabis in the last year. And 18% of those actually reported using it daily. So it's a lot more common than a lot of people recognize, and I really appreciate that we're at this time after legalization where the stigma is starting to go away. A lot more people are coming forward with being honest about their cannabis use, and it's not a shameful thing anymore, which is wonderful. I don't think it ever should have been, but we're moving into the light, which is great. Now, cannabis use for brain injury can help with a lot of symptom management, everything from anxiety, nausea and vomiting, headache, the ringing in the ears, mood, behavior and personality, concentration, memory loss, the irritability that can happen. It helps with sleep and rest, like you were mentioning. Or where did he go? Where did he go?
Carl?
Is he hiding?
Oh, he went to get more batteries.
Okay. Good for him. That's awesome. Rest, also helping with fatigue, and it helps with oxidative stress, like I said, so it's an antioxidant. Now, I have a lot of other really dry science that I was going to talk about, but I'll just sum it up. Basically, what they're finding is that cannabinoids are neuroprotective agents for brain injury. So if you already have cannabinoids in your system, if you've got THC specifically in your system before an acute brain injury, they've actually found anecdotally that you'll recover better, which is interesting. Not saying you have to take THC, but just something to be mindful of. And the other thing to be mindful of too is we actually produce, like I said, we have an endocannabinoid system, but we also produce cannabinoids endogenously in our system without even needing to take cannabis. And what they're finding is that there's this mechanism in our body where we're actually able to, in the instance of a traumatic brain injury, the body will kick in with those endogenously created cannabinoids and it'll help to protect the brain, which is really cool. So even if you haven't taken cannabis before, your body is actually secretly producing cannabinoids anyways, and it's protecting you anyways, which is pretty cool. There is a really great article that I wanted to pass around. If anybody wants a copy of this, please let me know. I'll email it to you, or I'll send it to you, or I'll point you in the right direction. This is from a website called projectcbd.org, and I brought brochures, so if you want to check it out, you're more than welcome to. This is what it's called, No Brainer, CBD and THC for head injuries, which is great. Their website is free, and what you can do is you can actually search your condition in the top search bar, and it'll come up with all of the relevant research. What they do is they take that dry science and they condense it into plain language, which is really great for people like me and you to understand how this can work in your body. There was a really great quote from Dr. Ethan Russo, one of the pioneers of cannabis exploration, and he says, "The neuroprotective effects of cannabis are well established in the literature, and there is a tremendous amount of anecdotal literature that cannabis benefits symptoms in both syndromes," so CTE and TBI, which is really cool.
Excuse me?
Yes.
CTE.
Oh, it's, hang on, let me see. Chronic traumatic encephalopathy.
Thank you.
Yeah, of course. Now, there was this really cool thing that, oh, go ahead. Yeah.
Could you just tell me the name of that website?
projectcbd.org.
CBD. Thank you.
Yeah, you're so welcome. So a few years ago, 5 years ago actually, you'll see this, there was a Harvard professor that was actually asking to have the NFL treat concussions with cannabis. This is 5 years ago, and that was Dr. Lester Grinspoon. He went on to say, already many doctors and researchers believe that marijuana has incredibly powerful neuroprotective properties and understanding based on both laboratory and clinical data. I've got a couple more dry sciencey bits, so we'll just skip over that. You're probably wondering what cannabis products are best. So like we said, vaporized cannabis over smoked cannabis is what I'd prefer people using. When we combust a substance, it's not as great for your health as if you were to vaporize it. The difference between smoking a joint and vaporizing cannabis is when you're vaporizing it, you're heating that plant material to a certain level where it's not actually burning, but it's releasing all of the medicinal properties of the medicine. So you're able to get all of the full profile, all of the flavor profile, but there's no burning, which is a lot better for your health. Cannabis oils and tinctures was something that was recommended earlier, or that was mentioned earlier, and very, very effective. You can take a microdose, so a small dose, anywhere between 2 to 5 milligrams of CBD, for example, and get some really great benefit. Edibles, medicated edibles, if somebody is looking to have a good rested sleep, a THC brownie, for example, could be very effective, anywhere between 10 to 25 milligrams. Topical lotions, like I said, and suppositories are phenomenal. The other reason why suppositories are great is if you are experiencing nausea, for example, as some of the symptoms, it can actually help to reduce the nausea without you having to actually eat anything, which is really great. Oh, sorry, I thought you had a question. Okay, cool. What cannabinoids are best, THC or CBD? Like I mentioned, both. So CBD is actually something that can help with the recovery, and THC, like I mentioned, can help with prevention. If you already have them in your system, like I mentioned earlier, you're actually going to recover better, is what the science is starting to point towards, which is great. And what we want to do is we want to saturate both the CB1 and the CB2 receptor sites, so the full body saturation. What terpenes are best? What smells? Go ahead.
Sorry, do you mind just going over that? The
Yes.
THC is for recovery and the CBD is...
Sorry, CBD is more for recovery,
Sorry.
and the THC is more of a preventative. But what they're finding is if you have the THC in your system previous to a traumatic brain injury, the recovery will be better.
Awesome.
Yeah, and I have the literature on that if you're looking for the science. Yeah, you're welcome. So you're probably wondering, okay, so yay CBD, THC, but what about the smells? Which smells are the best? You know, especially for traumatic brain injury. Clove oil, rosemary, and hops are a terpene called beta-caryophyllene. And terpenoline is a newer one that's come out, but those are the smells of nutmeg, tea tree oil, conifers, apples, cumin, and lilacs. So all of these smells will actually be helpful for recovering with brain injury, especially in conjunct with the cannabinoid therapies. Probably wondering too, so what dosing do I use? Do I start with 1 milligram? Do I start with 10? What do I do? Our approach is everybody's different. Your brain injury is going to be different than mine. Your physiology is going to be different than mine. And where we usually start with all of our patients is we start as a very low dose and we slowly work our way up. And it's also really important to be mindful of people's comfort level. Not everybody's comfortable using cannabis, so we don't want to push them in a direction that they're not going to be up for. So really starting with a low and slow dose, starting usually with a CBD product after a traumatic brain injury is where we start, and then we'll slowly dose up and see what kind of benefit that we can get over time. The other thing to be mindful of is the potency of cannabis. If we're looking at a raw cannabis flower, so that dried cannabis, versus a concentrated extract that's been lab tested and we know the potency, that's where we get a little bit tricky, especially if you have your cannabis that you've grown and you've turned it into brownies. Well, how strong are they? So that's something to be really mindful of too, and part of what we offer are cooking classes in the community. So if you want to learn how to make that conversion and understand the dosing, we can definitely help you with that. For naive users, like I said, we start low and we go slow. The average patient in Canada right now is using 2.7 grams of dried cannabis as a smoked or vaporized product to help with their symptom management. And in my professional opinion, the 1-to-1 ratio of THC and CBD seems to be the best combination for traumatic brain injury. Some of the adverse reactions that can happen with cannabis, and it is really important to talk about, are dizziness, disorientation, drowsiness, balancing problems, dry mouth, fatigue, anxiety and psychosis if we've taken too much of that THC like I mentioned, sometimes diarrhea. Euphoria can also be an adverse effect. I know that, if you're laughing so hard that you can be a little bit difficult for some people. We actually had a woman that came in and told me that. I was like, that's awesome. Confusion, nausea, vomiting, hallucinations can happen, arrhythmia, and orthostatic hypertension, or hypotension, my apologies. So somebody's blood pressure dropping really quickly is something that can potentially happen. So being mindful of that. In rare cases, but for some people, if they've taken too much THC, they can sometimes have an experience that feels similar to intoxication. So it's important to be mindful of. It's actually quite rare in medical users because they know how to use the medicine for themselves. In that type of situation, we do recommend that you seek medical attention. If you go to the hospital, what they're going to do is they're going to put you on a saline solution drip for 8 hours, and they're just going to monitor your responses until you come back. Kind of sucks, but sometimes you need help. Symptoms can also be of agitation, psychosis, anxiety, nausea, and vomiting, and oftentimes this is associated with edibles and concentrated extracts, so just to be mindful. Contraindications. So if you're currently taking pharmaceuticals, this is really important to note. Use with caution if you're taking an opioid. What we found with a lot of the research is that THC specifically can amplify the effects of opiates between 4 to 12 times. So that can take your very low dose opiate and make it very strong. That can also take that opiate and put it into a dangerous zone. Like I said, our endocannabinoid system does not have receptor sites in the back of our brain, but our opioid receptor sites do. So we need to be mindful of that when we're taking THC. Can cause delirium, and it's also something that I wouldn't necessarily recommend for women that are pregnant or breastfeeding, but if you are, please talk to me. There's ways that we can still work with the medicine. Possible drug interactions, warfarin, so blood thinners, theophylline, so asthma and lung disease, clobazam for epilepsy, alcohol, definitely an adverse effect. It can amplify the effects of alcohol between 2 to 4 times. So if you have that one glass of wine, it can feel like 4. Central nervous system depressants, so barbiturates and benzodiazepines, and again, opiates. So if you're trying to support a family member or somebody that you care about with cannabis, these are some things that you should really be mindful of. The first thing is managing expectations. Cannabis is a wonderful plant and it has amazing benefits, but it's not for everybody, and we need to really be mindful about being realistic about the results. So also looking at the symptoms. So if somebody has, a lot of migraines, for example, can help with that, and that can be are we at time?
Yeah.
Okay, good. Let me wrap it up. We want to be respectful and non-stigmatizing. So if they're coming to you saying that they want to use cannabis, listen to them, hear what they have to say, and look at the clinical evidence. And cannabis is not a curative agent, so a lot of people think that cannabis is this one-size-fits-all approach, but it's not. So it's not going to cure anything, but what it can be is a supportive therapy in the resolution of trauma in the body. Now, there are several different sources. You can go to a Health Canada licensed producer to get your cannabis. I know that some people are getting their cannabis from dispensaries in town, and unfortunately we're in this really weird situation where medical cannabis dispensaries who have pioneered this industry are now being shut down unless they comply, and they apply as a regulated retail recreational cannabis dispensary, which really goes against the system. So if you're looking for medicine from a dispensary and your dispensary has been shut down, please come and contact me. We have an affiliate in the community that I can connect you with. All of their products are lab tested and they are safe. And if you're looking for Health Canada licensed producer product, that's actually what we do. We can get you connected with a physician. If your physician is not willing to endorse you to use cannabis, we can get you signed up with a licensed producer. We can make sure that you've got the products that you need. Now, that's it. Cool. So thank you guys for listening, and I will be available for questions afterwards.
Thank you so much, Selena. Before my accident, I was I really indulged a lot in non-medical cannabis, but since then I haven't been able to. It just didn't work for me. No, that's not the same for everybody. It works for other people, which is why I'm grateful that she was able to come and speak to everybody. And also, I was really hoping that I could find a way that I could make it work for myself again. So
Maybe we can talk later too.
Yeah, we will. Something that has worked for me and continues to work for me very well is cranio-sacral therapy. It's for me, and once again, it's very different for everybody, just like Selena mentioned for cannabis, Carl mentioned with your own self-healing. Everybody has their own separate, and there's no two brain injuries that are the same. So everybody's going to heal differently. And for me, with cranio-sacral therapy, the improvements are very slow, but I know they're, once again, with what Carl said, it's more of a guided practice that helps your body heal itself. And I really noticed how much it was helping me most when I stopped taking cranio-sacral therapy. I definitely had a major fallout, and I fell backwards. I felt like I lost a year in progress when I stopped. So let's not discourage you from taking it any further. Maybe I should have thought about that a little bit more, but we'll let Shauna clear things up.
Pocket projector here.
Oh, really? What? Who are you? Oh my gosh. I'm a little bit off.
Good morning, and thank you for coming to the Brain Health Symposium here at Tidal Elements Healing Arts Studio. Really appreciate that you guys took this summery Saturday morning out to come and listen to those awesome talks. Yeah, and thank you, Selena. That was really, I learned so much. I was like, oh, I want to write this all down. I'm just going to come and see you.
Come see me.
Yeah, come see you, yes. So, yeah, and I'm really appreciating that you can see some of these slides. I'd like to introduce biodynamic cranio-sacral therapy. So it's a mouthful for even someone without a TBI, ABI, or a concussion. The title can be overwhelming to say, however, the therapy works with grounding and settling in the nervous system. I'm excited to share this therapy because of witnessing the profound effects it has on bringing back the body to health. But mostly it has changed my life since I was introduced to it 5 years ago. Through BCST, I found a depth of healing in my body while healing from a life-threatening illness. So I have an intimate relationship with the therapy. So who here in the audience has heard of biodynamic cranial-sacral therapy? Oh, that's quite a bit. So NSD has, so thank you for introducing therapy. I was just curious if anybody has a word that could describe it or would like to share. And no pressure, that's okay.
Relaxation and flow.
Nice.
Space.
Reorganization.
Nice. Love these words. Yeah, sometimes it's hard to find words to describe what happens in the therapy, but I appreciate those words. Okay, so I'm going to try to break it down. Bio, meaning life. Dynamic, meaning movement. Cranio, or cranium, is head. And sacrum, tail, or end of the spine. But you guys didn't realize you had a tail. But you do, it's underneath your skin, and it only wags as you walk. Okay, so I tried that joke out when I was doing the presentation. My partner didn't laugh. I thought that was funny. The cranium in the base of your spine has a continuous sheath of connective tissue surrounding it. In this structure, cerebral spinal fluid flows and bathes the brain and the spinal cord. So some of those words that I heard was fluid and flowing. In the beginning of the therapy, which is rooted in osteopathy, the founder, Dr. Sutherland, found that health could be palpated in the cerebral spinal fluid. Later in his work, he discovered that health can be palpated throughout the whole body. So by using a gentle, non-manipulating skill to touch, a BCST, that's biodynamic cranial-sacral therapy, practitioner listens to the original health of the body through the anatomy and the autonomic nervous system and subtle expressions of the body. So I'm going to explain the autonomic nervous system a little bit. But basically, BCST brings the body back to original health. How we grew from one cell to a trillion cells is how we heal. The forces that formed us are the forces that heal us. So it's pretty big. So just kind of sit with that a little bit. Okay, this is you don't have to read all those words, but I just wanted to demonstrate what's called the cortical homunculus. That's a big word too, so you don't need to know that either. But it demonstrates, so our body is a two-way street. Information comes in and information goes out in order to deal with our external environment. On this slide, blue is how we bring in the world, and red is how we output, we react, we survive. So we're dealing with our external environment. The slide may help you understand how a BCST practitioner can listen through touch. It also gives us an idea of how the brain manages sensory information. A large piece of our real estate is designated to the sensory information picked up by our hands. It's kind of like whiskers on a cat, our hands, bringing in the world. Our hands can be trained to high levels of sensitivity. So has anybody used a broom in this room? Okay, just one person, that's great. Okay, so when you sweep the floor, you can feel the floor through the broom. So this is highly sensitized touch that we've learned. And you can think of other examples and use other examples. Because you're not actually touching the floor with your hand, but you're using the broom as an extension of your hands. And that's how highly sensitized our hands are. So what goes up must come down. This is the central nervous system, which includes the brain and the spinal cord. The cerebral cortex, which is the jelly bits of our brain, computes the information taken in by our senses, which we have a lot of, and then sends a signal to make a move. A TBI, ABI, or concussion can severely alter both signals. The going up into the brain, which is called the sensory or efferent, can be misperceived, and the signal going out can be miscommunicated. So this is a part of the autonomic nervous system. This is the parasympathetic nerve called the vagus nerve. The autonomic nervous system is a control system that acts largely unconsciously and regulates bodily functions. It's different than the central nervous system. And don't worry, there's not going to be a test. So its branches are, you guys have heard of this, rest and digest, which is the parasympathetic nervous system. And the sympathetic nervous system, that branch, is always running, and it's the it's the fight and flight. So that's pretty popular lately, to a lot of talk about fight and flight. So what is trauma? Just building upon what Carl was talking about, I was really liking some of the points that he made in his talk as well. Trauma can be defined as anything that overwhelms our resources. So this is definition by Peter Levine, who's a leading expert in trauma and healing through trauma and trauma resolution. So with overwhelm, we rely on our primitive brain, primitive responses like most mammals do in the wild. And they are hardwired into our physiology. So as humans, we always have the basic question whether we're safe. So we're wondering, am I safe? Am I safe? We're constantly doing that in our external environment. We're trying to figure out if we're okay, are we safe? And if the answer is no, then our physiology prioritizes its resources. So our physiology will go into fight or flight or freeze, which I'll explain. And if there's a no, there's no rest and digest. But I'd sure like to learn that, no matter what comes up. Right? But that's how we're wired. This is how we respond to our external environment. We all know what fight and flight is, but maybe not the freeze response. So freeze is where the nervous system checks out due to high levels of overstimulation and lack of resources. It's also called disassociation. So we come outside of ourselves because the experience is so big that our nervous system is like, I'm out, I'm done. A TBI, ABI, or concussion are traumas. Okay, so they're not planned. And therefore the feeling, am I safe, is compromised. I'd also like to point out that low-level chronic pain signals from a TBI, ABI, or concussion can cause, so low-level chronic pain signals, facilitation, which is a highly sensitized nerve, and inflammation in the brain can also cause that system, or autonomic nervous system, to go into overwhelm. So you have the trauma, but then you have the symptoms of the injury also stimulating the nervous system, the autonomic nervous system, and going into fight and flight. And so I also want to point out, so when we're in fight and flight, not much healing can happen. Like if you're running away from a tiger, you're not going to go into healing mode. So if you're stuck in that fight and flight, then the healing can't happen. And then also for disassociation, you can't heal what you can't feel. So here's a photo of a session. BCST provides a safe environment for trauma resolution and autonomic nervous system regulation. The BCST therapy training provides 2 years for the therapist to deepen into their own embodiment and presence. Being there is no small thing. Just being there, just listening. It is and how relieving is it to just be heard without someone providing a solution, intervening, or trying to offer advice. Just sitting there being listened to. Orientating to the flow of information from the body in the present moment is a powerful way of inhibiting the flight and flight response. It is hard to think your way out of anxiety and much easier to orient and feel your way out. The initial skills to work with overwhelm in BCST are creating a safe relational field and supporting the development of resources. So I just thought I'd work with that a little bit, working with our, bring ourselves into our body. So, I mean, I think people are pretty calm, not so much in fight and flight, but your body is running in sympathetic. So just, we did a little bit, Selena did a little bit, so we'll just close our eyes, find ourselves in our seat. So I just want you to begin to notice your state, sort of where you're at right now at this moment. Just notice it. You don't have to say, oh, I wish I was feeling this way, I wish I was feeling that way. Just notice your body. Just notice you on the chair. And by doing this, you can notice your sit bones on the chair. Just notice the contact of the chair. Notice how the chair is supporting you. And then just notice your feet on the floor. Have a sense of the floor meeting your feet. And then have a sense of your feet on the floor. Now bring your awareness to your breath and taking a nice deep breath in through the nose and exhale through the mouth. And one more deep breath in through the nose and out through the mouth. Good. Now just wiggle your fingers and then slowly open up your eyes. Maybe you noticed a change in your body and maybe you didn't, but it doesn't sometimes always work instantaneously. So this is kind of a sympathetic nervous system slide where you're like, ooh, what is that? That kind of can get your heart racing. I want to show this slide because the brain has many structures, but most of all, it is fluid.
Oh, wait, I thought
There's something going on. When I walked in the door, the whole explosion happened. A little bit like jumping. Right when I walked in the door, the lights went out, and it was like boom, and the transformer. I was like, holy. Breathe, center, feet on floor. I am present. Here I am. Okay, so the brain has many structures, but most of all is fluid, and this slide does not show how the brain is fluid at all. It would be hard to show the fluidity of the brain in real life time. I have another slide that shows it a little bit. The brain is also thirsty. It needs gallons and gallons of blood each day to function properly. Although this photo isn't fluid, isn't a fluid-looking cranium, it shows the size of the vessels that carry the blood away. So you guys see that blue? Those are giant venous vessels that take the blood away from the brain. So if there's the dura, which is on the right-hand side, you guys see the white, encases the brain and the spinal cord. So after a TBI, ABI, and a concussion, dural tension, adhesions, and drag can exert a strong effect on the flow of blood into the cranium and out of the cranium. So buildup of blood can give you that full feeling, that dizziness, that disorientated feeling. So the sensitive touch of a BCST therapist releases dural adhesions through orientation to the body's intelligence, which allows health to move through trauma. We're not actually moving the dura. What we're doing is orientating to the original health, which comes up and allows the adhesions to find their way out. Here's the cerebral spinal fluid. So this is a fluid brain there. You see, that's just a little bit of an example. The human brain depends on socialization to develop. It really does. Like if we don't have socialization as a child, then there will be deficits in our adult life. One of the main symptoms of a TBI, ABI, and concussion is brain fog. Brain fog can be difficult in our culture, which places emphasis on mental reactivity, clear and sharp thinking to maneuver through social situations. When you used to know that word and just it doesn't show up when you're in a social situation, much how I feel when I'm talking right now, actually. That might not show up. I have words on the screen, which is good. That could feel uncomfortable. And that leads to anxiety and depression. Through orienting to internal and external resources, BCST regulates emotions and calms social activation. Internal resources are about our inner life. They're about our internalized working model of the world. So it's our ability to feel secure and relate to others. And the quality of our feelings and emotional life, where external resources are the environment, people, places, activities, and things in our life that bring a feeling of safety. That's in our brains. There are over 100 billion neurons in your brain, which is about the number of stars in the Milky Way galaxy. Holy, we've got many galaxies sitting in this room. It's really cool. The neurons are not dry copper wires, rather juicy fluid tissue that has been around since you were created. They are the oldest cells in your body, and they create stories. They develop bonds over time that are a familiar route, like a river etching a canyon. So if that canyon has been disrupted, which what happens in a TBI, ABI concussion, you know that the neurons are healthy enough to build new pathways and etch new canyons afterwards, even if the canyons have been destroyed. So your brain is the most complex, mind-blowing organ in the universe. I just want to end this talk reminding you that even if there has been a trauma, remember that health is always there. And then here is 4 practitioners that are biodynamic cranial-sacral therapists here at Tidal Elements. So if you are curious about what a session is, because I always feel it's better to come try a session. I try to use words to describe what you feel and sense in a session, but the best way is to experience it, the experiential wisdom. Yeah. And I think that there's cards on the way out too. So yeah, thanks very much for listening.
Thank you, Shauna. And that experience of craniosacral therapy is, it's kind of undescribable. And I think it's different for everybody. I can feel all sorts of things moving around inside my body when I'm getting craniosacral therapy done. It's a positive feeling. It's not, for me, it feels good. It feels like things are realigning and going back to where they're supposed to be. I feel like things are a little out of place and we need to be able to put things back into place, right? Mm-hmm. That's what we're all here for. That being said, one of the best things that I've done for myself is I got involved with music. It may be hard for a lot of people to comprehend because a live music performer, you're in bright lights and loud music, and there's all sorts of commotion, and all that stuff is really hard to deal with. But for me, when I'm playing music and I'm really lost in the music, that's the only time I ever feel 100%. All of my symptoms are gone, and I'm just fully submerged in the music that's coming out of me. And so I'm really excited to introduce Kaylen Lesko. She's a music therapist based in Kelowna, and she's going to talk to you guys about how music can help us in the brain injury world.
Thank you, everyone. I wrote out my entire script. I've been quite ill lately, so I had to write out my entire speech. So bear with me as I kind of get through it, but hopefully I can get the information across to you all. Can everyone hear me in the back, or do you need it a bit louder? You're good? Okay, perfect. As Steve said, my name is Kaylen Lesko, and I'm an accredited music therapist who runs Okanagan Music Therapy here in the Okanagan, and I actually work in Kelowna all the way to Vernon, so anywhere in that space, I'm traveling around. I just want to begin with a huge thank you to Steve for organizing this event today. I know we can give him a lot of energy in that, and the gratitude that we feel for him putting together these unbelievable speakers and bringing us all into this space for a day that really, I feel, is rooted in hope, giving us different alternatives, giving us different answers for maybe something that we've been struggling with and something that we haven't been able to find any sort of relief for. Not to mention some relationship building. It's just nice to see so many faces coming together with a common goal. So with the question I get asked most often since I moved out to the Okanagan, I've only been here for a few months actually, is what is music therapy? And the thing is, I could spend the next 10 minutes explaining that to you alone, but I'll try to refrain. To begin though, the Canadian Association of Music Therapists, which is our governing body, describes music therapy as an evidence-based discipline in which credentialed professionals use music purposefully with therapeutic relationships to support development, health, and well-being. Music therapists use music safely and ethically to address human needs. And while that's helpful to hear, I also realize it packs a ton of information into a very brief statement and doesn't totally answer, I think, the root of what we all want to know. So at Okanagan Music Therapy, music is utilized as a tool to support the therapeutic process. As a familiar medium to most, it has a unique ability to inspire emotional responses through the natural connections and feelings of security that can be fostered when listening and creating. Music becomes a partner in the communication and can help clients to reveal ideas that they may not be able to express using words alone. Music therapy is designed to provide a stable and supportive space for free exploration, but within a structured framework. Clients will engage in music and discussions that contribute to increased empowerment, agency, autonomy, and healing and recovery, and the ability to better manage those difficult feelings. Alternatively, music can also facilitate the development or rehabilitation of a variety of physical, verbal, and self-regulatory skills. Sessions are designed around exploring and identifying clients' strengths by adapting each session to the needs, goals, and interests of those clients, because really that client is first. I can't come in and ask you to do anything that doesn't feel right to you. The most unique facet of music therapy, though, is how many domains it branches into. We understand that illnesses aren't one-dimensional, and just as with brain injury, I should say, which affects aspects like your cognitive functioning, your physicality, your behavior, your social interactions, and so forth. For this reason, music therapists work from the foundation of 7 key domains, and that's actually the basis of all of our education and then our work moving forward. Those domains are cognitive, social, communicative, emotional, physical, musical, and spiritual. The interventions that we choose weave between the desired areas for the clients to ensure that a holistic and client-centric approach is always our basis. Now, I recognize that I'm likely pretty biased, but music therapy is also a really exciting area currently to be involved in, because we're finally beginning to scratch the surface with regards to research. Historians have come to realize that music has been utilized for healing for centuries, but it isn't until the last 3 or 4 decades here that modern science is finally beginning to try to investigate why. The field of neuroscience is actually studying music all over the world, as researchers are beginning to identify that music is a powerful tool for understanding brain functioning. Due to the complex nature of music and how it engages the entire brain, it has the ability to involve a host of cognitive processes such as auditory analysis, information processing, sensory motor integration, learning, memory, decision-making, and so on and so on. But above all, there's some really fascinating information coming out with regards to brain plasticity in music, which, when healing from a brain injury, is so essential. For this reason, music-based interventions have shown overwhelmingly promising results with clients suffering from various brain injuries with regards to rehabilitating movements, gait-related issues, improvement in speech production, sensory perception, just to name a few. Additionally, a common symptom of traumatic and acquired brain injury, as I'm sure many of you deeply understand, is mood stability challenges. Once an individual has suffered a trauma or change, such as an injury like this, depression, anxiety, and agitation often follow and become a really disruptive force in one's life. It's here that music therapy, I think, really begins to shine, as they take the science that I'm not going to get into, because again, it's super dry, and I'd be happy to pass along any articles or pass along information, discuss that with you. But take that science and really it turns it into something magical that is really challenging to explain. And then that's the other challenging part of my job here today, is to try to tell you exactly what would happen in a music therapy session, because every client is so different. As you know, every traumatic and acquired brain injury is unique in what area it impacts and how it really affects the entire individual. For this reason, no 2 sessions or interventions are ever the same. I recognize that this is extremely sensitive and compassionate and deeply personal work. So this is why one of my primary considerations when working with clients living with brain injury is to address all of the aspects of the person sitting in front of me, not just the challenges. These include 3 things. Number 1, who was this individual before? What was important to the human in front of me prior to this injury, and how can the music and our therapeutic relationship access those memories? I can then use those music-based anchors to support the ongoing rehabilitation. Number 2, who are they now? What does this individual need now, and how can music help them to feel successful and encouraged to continue on their healing journey? And use it intentionally. Music therapy can improve many symptoms that may result from brain injury, as we said, such as impairment of speech and language processing, physical movements, cognitive processing, disorganization of memory, and emotional distress. And finally, number 3, who do they desire to become now? What does this person hope to achieve, and how can the music support them to get there? I work closely with my clients to ensure that specific goals are met and that sessions are developed to approach these areas. Without a doubt, the most important and humbling aspect of my job as a music therapist is to ensure that the whole person is considered during the sessions, that every aspect of the individual is addressed. Healing is never just a physical pursuit, as I'm sure each of us know, but in order for true wellness, one needs to heal our mind, our body, and our spirit, all in conjunction. Music has the capabilities to do just that. And as I end here, I realize I just gave you a ton of information, but I want to leave you with a quote from a client of mine that I worked with last year who had just suffered a stroke. She said to me, "Music therapy helped me to find myself when so much of me was taken away. The music helped heal my voice, my hands, and my heart." So again, I'll be around after the presentations if anyone has any questions. I've brought some business cards that I'm more than happy to pass around that I'm open to be contacted at any time. Again, I have some research if you're interested in reading the science, or if you just want to have a discussion, I would be more than happy to. So thank you so much for being here today, and I hope you all find the answers you're looking for in the healing journey that's best for you.
Thank you, Kaylen. That's great. Music therapy. Yeah, it's a fairly new thing.
Do you guys have any water or anything?
There is water over in this corner over here. I'll just add also that right here in this studio they have crystal bowl healing therapy sessions, as well as sound baths. So if you guys would like to look into other sound modalities, then there's a lot more out there, and that goes back to, just like I said, I had to find all these modalities on my own, so let's try and make these as available to you guys as possible. So here's another new one for me is infrared light therapy, and we have from Untitled Elements here, Cecelta White to talk to us about that.
So my name is Cecelta White, and I'm here to talk about brain health and infrared light. And I'm going to tell you a little bit about my background and a little bit of education about acquired brain injury, and then about infrared light. So I probably will have to sit down because the light from my computer lights my nose. So, but we'll start up here. So my name is Cecelta White, as I said, and I'm in partnership with Untitled Elements, this amazing resource we have right here in Vernon. I feel so blessed to be partnered with Untitled Elements. I have actually used it as a resource for myself, which I'll get into. There's so many modalities, as Stephen has mentioned. Float tanks are also another one I'd like to mention. So my background, my educational background is in natural health science, and I owned a natural health clinic in Ontario for 15 years until I sold it to move back home to Vernon. So I actually was born right here in Vernon, but spent my younger years in the beautiful, beautiful forests of Vancouver Island, right near the northern tip, right near Haida Gwaii. Absolutely breathtaking, and then came here for my teen years to finish up before I went to university in Toronto. I was diagnosed with a spinal disease when I was 7. I had acquired it when I was about 2, and it impacted my life significantly. I had spinal deformities and muscle degeneration for most of my life, and I was put into a body cast from head to toe for 4 years in my teen years, because that's what they did back then. And it did work too. I am very fortunate they had that then, and I was able to avoid surgery. And what that did, that experience was, I was raised by a single mom. So here she has this daughter encased head to toe and in a body cast, and she taught me, instead of looking at what I can't do, what I could do, and to problem solve. So that experience has led me to my path and my vocation my entire life. So even though it was challenging, I became a problem solver and to look at what I could do. So that led me to wanting to help other people, as I was finding ways to overcome some of the challenges I experienced. It did continue to progress, and more recently, they did diagnose it as MS, which is considered an acquired brain injury, and they have, they're thinking that it was started in my spine. So that was just at a very young age. So I'm telling you all that to say that I do understand, and dealing with a changing body and adapting, and that sometimes acceptance, but also looking at ways to move forward. So it's kind of this balancing act. And that's just, I just wanted to say to you, I do understand, and we're in this journey together. And I think I might have to sit down to read my notes here and put my glasses on. So one of my challenges that I knew very early on was that I learned more visually than auditorily. So that's why the slides I have can help you learn, and if all these words all afternoon just float by, it's okay. Look at the pictures. So brain injury is a puzzle. All the pieces are there, but in the wrong order. Who feels like that?
Is there any way we could back that projector back and then blow up on the wall so we can kind of see it a little bit back here?
Okay, we're going to get the tech support here. Okay, tech support is coming. Okay. Oh, there we go. Okay.
You can come sit up here too.
Yep, there's seats up here.
There's lots of seats up here as well.
Okay. Okay.
It is a pocket projector, that's why it's...
Yeah, it's a pocket. There is seats up here, so come on out, and I'm going to read all these words, okay? So what is acquired brain injury? So it is an injury to the brain as a result of a cause resulting in impairment for the person. So what are the primary causes of acquired brain injury? Well, we have things like trauma, which we have been discussing here. We have things like stroke, which has blocked blood vessels, hypoxia or anoxia, which is lack of oxygen, alcohol-related and poison-related issues, infection, and degenerative diseases like multiple sclerosis, Huntington's, Parkinson's, and Alzheimer's, and tumors. So those all fall under acquired brain injury. So acquired brain injury is not a developmental disability or autism. There will be 1,800 new brain injuries this year, and men experience brain injuries twice as often as women. And ABI affects cognitive, emotional, behavioral, and physical functioning. ABI is damage to the brain that occurs after birth. And brain injuries can be a non-visible disability. And 1 in 26 Canadians are living with a brain injury. Okay, so I did want to say I'm going to be discussing things right now that might feel even sometimes traumatic hearing, because I'm going to talk about symptoms, and sometimes they're distressing. So I just want, we're just talking about symptoms, and then we can talk about ways you can help them. So I just wanted to acknowledge that. Acquired brain injury, again, this is a little graph. So under acquired brain injury falls traumatic brain injury, and then there is the other ways of acquiring a brain injury. So that's just to help you categorize, just a little diagram there. So brain injury, it's so invisible. And these are some things people say. I wish I had a big scar so people could understand that something was wrong. No one can see my pain. Sometimes my behavior confuses people and confuses me too. And no one knows who I am. The effects of acquired brain injury, they can be devastating and long-term, and each person is unique because they're affected in different ways. Following a brain injury, the person usually experiences problems with many aspects of their life, and you can see the list there. Their health, physical, sensory, cognitive, communication, emotional, social, and financial. And as Shauna discussed and showed, the reason it's so puzzling is everybody's brain injury is unique because it depends what area of the brain is affected. And so this graph, it's hard to read, you can't read all that, but it just shows, what it does is it shows, okay, if it's the frontal lobe, these are some of the, you could have personality or behavior. If it's different lobes, different areas are affected. And I just liked this imagery because when I saw that, I could relate. And I kind of feel like that sometimes, right? And this was really poignant. I actually have to tell you, when I was putting the slideshow, I actually got a little emotional when I read this one. It says, I'm faking being sick. You must be confused because what I'm actually doing is faking being well. I don't always talk about all my symptoms. I don't always admit when I'm not feeling well, and I often put on a happy face because it's just easier that way. Any idiot can fake being sick. It takes real talent to fake being just fine when you feel like hell. So, we're all, and just know you're not alone. You're not alone. Like 1 in 26 Canadians. Physical effects, so of acquired brain injury, anything. So you might have none of these, you might have one of these. So you can have weakness, you can have stiffness. So who knew stiffness? You can have poor balance. That's one that is very common, is poor balance when I'm talking to people. Changes in sleep patterns, so not being able to sleep, not being able to stay asleep, not being able to fall asleep, sleeping all the time. Seizures, headaches, changes in vision, smell, or touch. As I've progressed, hot sauce is my favorite thing. It's just this bizarre thing that's happened. I just have to put hot sauce on all my food. So changes in thinking or learning. Problems with memory, again, more common, and sometimes comical. If you can just be on that comical side, some of the words that come out of my mouth are the opposite of what I'm trying to say, and you just have to laugh. You just have to laugh. So difficulty with planning or organization. People who are used to being multitaskers extraordinaire, run households and businesses and families, and now have to just do one thing at a time. And there is a gift in that. Difficulty with communication or having a conversation. Symptoms of acquired brain injury, so also behavior, mood swings, irritable, feeling on edge, and even changes in our personality. I just saw this slide and it just spoke to me because sometimes I just felt like my mind was drifting away. So one of the things that a lot of people don't talk about is the fatigue. In a lot of brain injuries, I know with MS, fatigue is a huge part of it, and it's something that is not seen. And so, being somebody, perhaps you were somebody who could just, go all day, and now for some reason, just one task and you need to sit down and take a rest. That is common. As recent as 2012, the Nobel Peace Prize for Science that year was on proving, without a shadow of a doubt, brain neuroplasticity. So what that means is the brain can rewire and heal itself. So I'm just going to read what I've written here with my computer light. In the brain that changes itself, Norman Deutsch describes the most important breakthrough in our understanding of the brain in 400 years. The discovery that the brain can change its own structure and function in response to mental experience, what we call neuroplasticity. His revolutionary new book shows for the first time how the amazing process of neuroplastic healing really works. It describes natural, non-invasive avenues into the brain provided by the forms of energy around us: light, sound, vibration, movement, which pass through our senses and our bodies to awaken the brain's own healing capacities without producing unpleasant side effects. For centuries, it was believed that the brain's complexity prevented recovery from damage or disease. The brain's way of healing shows that this very sophistication is the source of a unique kind of healing. And chapter 4 is titled Rewiring the Brain Through Light. And it was my own journey of always finding ways for personal healing and then passing that on that led me, ironically, to finding infrared light. So I'll just go into infrared light therapy and what it is and how it can help. We're just going to be really simple with the science because I know it's the end of, and you've got a lot of information. So basically, infrared light is just light we can't see. So if you look at the diagram here, the violet is the shortest wavelengths of light that our brain interprets as violet, going through the rainbow spectrum to red, which is the longest light we can see, and after that, the light waves continue, we just can't see. It's still just light. This picture here just shows the difference, and so there is wonderful benefits to all colored light therapy, but the deepest, the light therapy that extends into our body the deepest is infrared light, and as you see in this diagram, it actually goes into the subcutaneous layer. So when infrared light therapy gets into the deeper layers of the body, it's able to dilate the blood vessels, and this allows more oxygen and nutrients to go to the tissues in need. So we've talked a lot about how important oxygen is to our healing. So what we're doing is dilating the blood vessels to allow that oxygen to get to the tissues that need it. How is this done? It's through the science behind nitric oxide. So when our body is exposed to infrared light, it releases something that we have in us called nitric oxide. And the nitric oxide relaxes the smooth muscles around the blood vessels so that more blood can get through to the tissues of the body. I think that's all I'm going to say about that. I love this picture. This just shows the largest blood vessels of the body, and they act like hoses that help to irrigate the tissues of the body. So here we show some of the smaller blood vessels and how they supply more places within the body. The red vessels take the oxygenated blood to the tissues, and the blue vessels are bringing the returning deoxygenated blood back to the lungs to get more oxygen. And this cycle will continue over and over many times over the days and the weeks and the years of our lives. So it's not just muscles that need oxygenated blood. The health of our organs rely on good blood supply too. So many of our digestion, respiratory, and reproductive issues in life could be working better if the area was being supplied with more oxygen-rich blood. And also our brain. Isn't that an amazing picture? Yeah, I don't think I need to say anything. Just look at that. Because capillary beds are so small, there isn't very much wiggle room for red blood cells to move around. So I really like this diagram. It shows the red blood cells kind of lined up like a choo-choo train to get through, all lined up in a row. So you can imagine if those are not dilated, there wouldn't be, even the little red blood cell couldn't get through. This is a great slide, and it just shows here that in order for the fresh oxygenated blood to make its way to the tissues of the body, they meet in a place called capillary beds. And these beds are in a place where the oxygen and the nutrients are actually absorbed into the tissues of the body. And there they are. And this is this cool word called angiogenesis or angiogenesis. And what this means is once you've increased circulation to a certain point in the body, and you can keep that going for a certain amount of time, the reformation of microcapillaries, that's just a fancy word for explaining that the body can regrow blood vessels. And there they are in the brain. Shauna talked about the parasympathetic and sympathetic nervous system. So this is just a really cool thing that happens. It's an interesting point. So when our body is exposed to infrared light and release nitric oxide, it actually causes us to go from a sympathetic nervous state into the parasympathetic. It's our body's natural reaction. And so we then are into rest, digest, relax, growth, repair, and development. I am a Star Trek fan and Star Wars fan, so I had to put the slide in. So as within, so without. So it just shows there's a lot more things in our blood other than red blood cells. So to help with immunity, we have all these things. We have white blood cells and platelets, and they all help with immunity. And this is an actual, microscopic picture, I think is what you call that, of a blood vessel packed with red blood cells. Look how many there is in that. It's quite amazing. So what is infrared light beneficial for? So many things. So many things. So I use it on my back as well as on my brain. And it is personally, I'll just tell you personally, there was a period when my symptoms were progressing that I had cluster migraines. Those are not fun. I didn't even have a headache before, and they are debilitating. And through cranio-sacral osteopathy, massage, and infrared light, I could go months without a migraine. So that to me is amazing. So I just I don't even have a headache as long as I use my infrared light therapy every night, and that's my personal experience. So what we want to do is turn our brains back on, and hopefully with infrared light that can assist you. I know it has for me and for a lot of my loved ones, and that's just a great picture of a brain turned on. This is one of our friends using the Brain Light Pro. It's very comfortable, and I have one here, and I was going to turn it on, but we don't have power. So it just shows, look at it here, isn't she lovely? and it does use a combination of red light and infrared light, just because that area of our body is a little more sensitive, and they found that this will make sure we're not triggering any migraines or headaches, just being a little gentler with the light therapy. So we kind of have three choices of how to incorporate infrared light therapy into your personal health practice. So one of the ways is just to try it, and you can book a session here at Untitled Elements. Another way is to rent a device for a week, and you can use it in your home multiple times, and your family. It's very cost effective if you have somebody with a sore back and a brain injury and a sore foot and a broken, you can use it everywhere. And it's also available for purchase if you're somebody who has an ongoing problem. It's the most cost effective just to purchase your own. I do free talks here at Untitled Elements every month, and at that time, I go a little more into depth about infrared light, but you actually get a free trial of an infrared unit of your choice. So I encourage that, and it is free, and it's short hour, because I realize it's summer, we want to be outside. And I just wanted to thank you all and say this is our beautiful Leslie there. Oh, she's kind of fuzzy. Who can help me? Yes, I'm just going to show you the unit and we have several units for different areas of the body. And this is called the Brain Light Pro, so it's very portable, it's very easy to use, and the components are made in Germany, which is very important for medical health devices, and they are assembled in the States so that we're not shipping them back, overseas. And you simply put this on. This goes on your brainstem on the back. You part your hair. You have beautiful long hair like her, and you just put it there. And you use the Velcro to attach it, and the light goes on, and you just relax for 20 minutes, and then it beeps and it goes off, and everybody experiences something different. The more you use it, I think the more, I just feel more and more relaxed, but everybody's first session is really quite interesting. And I like to use mine just before bed, because I do find that it slips me right into that rest and relax and digest. So yes, I have brochures and cards, and thank you so much. I know it's warm in here, and this is a lot of information, and I thank you all for your presence.
Thank you, Cecelta. I want to thank you all. I think it's the heat, maybe causing a little bit of lightheadedness. I want to thank you all for being here and being so patient and dealing with our power outage issues. We are going to be going a little bit over time. I hope that's okay with you all. I'm really excited to introduce our next speaker, Rob McMillan, who is a physiotherapist here in town. He's located at East Hill Physiotherapy, and he is part of the Concussion Management Association.
Complete concussion management.
And yes, I'm really excited because he's actually very passionate about the subject. And I've seen several physiotherapists over the years, and I appreciated Rob's attention to detail most from all the people that I've seen.
Thanks, Steve. And thanks, Tidal Elements, for getting everyone together. It's turned out to be a pretty special day. We'll remember the day that the lights went out and air conditioning turned off, and we all stuck around and learned a lot. I have already. I was stealing Wi-Fi from somewhere down the street, but that just got out of range, so I'm using a PDF version of the presentation, an older version, so I'm going to be skipping through quite a few of the slides to shorten it, but I'll try to hit all the major points that I thought would be useful or at least interesting for us today. So I am a physiotherapist here in town. I also am part of the Complete Concussion Management Network. So Complete Concussion Management it's a certification and training program for healthcare practitioners. It covers, there are now over 200 clinics worldwide. Most are in Canada. It did start in Canada. The training program is there are physiotherapists who are practitioners, there are some chiropractors, and there's some physicians. It fills a real need because, as we'll see in a little bit, there are some shortcomings with the current medical system that's been alluded to. My training is, is the best way that I could find to fill that gap. As I was working with lots of concussion patients, I just found that it was an area that was moving so fast, things were changing so quickly, and this is the most up-to-date training that is available. We are in communication with physicians, specialists, and then that's important because we'll see that they are often the ones that drive the current medical system. They're the ones who are responsible for when people are returning to work. They're responsible for when people are deemed recovered from car accidents. They're responsible for letting high school and recreational athletes when they return to play. So we are advising them on these things, and so far in Vernon it's been amazing reception. Every physician that I work with is completely on board, and then we're the ones who are working with the clients on various forms of treatment that we'll get into here. I want to talk about a few current issues, a real quick definition of concussion that I use to help explain recovery. Baseline testing and return to work, learn, play in fresh, acute, new concussions, and then what happens when a concussion does not heal within the expected time frame, which is 4 weeks. Then it's defined as post-concussion syndrome, and we'll talk about what is still possible to work with there. And prevention. If we go back to return, work, play, and when I talk about the immediate treatment that's involved after a first concussion, it's the primary goal, other than the obvious, is to prevent it turning into post-concussion syndrome. We're already a pretty well-informed group here today. We know that the prevalence is quite high and very underreported. What we maybe didn't know is that healthcare providers are not trained on concussions for the most part. It's not covered in most medical schools. Only 30% of doctors knew proper management return to sport as of 2014. One extreme example of this problem was in Ontario, where I'm from. Not too long ago, a 17-year-old rugby player died after a tackle. It was not incredibly vicious or anything, but what came out after was that this was actually her third concussion in a short period of time. So she'd been hit 2 weeks prior and 1 week prior. She was complaining of headaches, but when those went away, she felt 100% again. She was asymptomatic. She played again, got hit again, and then died shortly after. It's not a failure on her part because she wouldn't have known any better, but it is a failure on the medical system because no one advised her parents, coaches, yeah, doctors, everyone around the school. That's actually led to Rowan's Law, which came into place just last year, and this is only in Ontario, but it will be here very soon. That is that every school has to have a return to play protocol set out, and everyone has to reach certain milestones before they're allowed to play again. Finally. Really quickly, a concussion is an injury due to acceleration. It doesn't have to be a hit to the head. The head doesn't have to hit anything. But if the brain accelerates, we have two different density parts of the brain. There's the gray matter and the white matter. One is more dense than the other. I don't remember which is which, but when the acceleration happens, then they shear apart, they stretch. Okay, it's not a bruise, which is probably the most common explanation. But what happens when this shearing happens is two phases to the concussion injury. Keep these in mind. Number one, excitation. That's right away. That's the brain cells firing when they don't need to, but because of the acceleration. That's the initial daze. The initial daze with a Z, just the seconds after that maybe. And then following that is the energy deficit. energy deficit happens because when all the brain cells fire, it takes ATP or cellular energy from the brain to bring those cells back to their normal resting state. Skip some science. Oh, I love that one though. As far as timeline, I'm going to cover up that bottom bit because that's mice. Up here is people. So the peak low in actual energy level in the brain is around 5 days. If you've talked to anyone right after a concussion, that is when the major fatigue and tiredness sets in. And then to come back up, to bring the energy levels back up, it takes about 4 weeks. So this is the best graph, but it's all together because it's a PDF and not a slideshow presentation. Yeah. So I have a pointer that I'll use and we'll follow along. 100% brain energy level right here. And then a concussion occurs, that drops about 20%. And then over the next 2 to 4 weeks, it goes back up to normal. On average, 7 days, and by 10 days, symptoms are gone in 85% of people. But the energy level is still working its way up. If it gets back to normal, then all of the brain cells are back to their regular state. If another concussion occurs, it's the exact same timeline, approximately. And then if full recovery happens again, then we're good again. So this window here, between 7 to 10 days when 85% of people are feeling 100% good, but the energy level in the brain is not back up to 100%, that's the window of vulnerability where if another concussion occurs, the energy level drops further, exponentially more, and the recovery time is exponentially more. Okay, so now we're looking at 3 to 4 months, and it's a lot harder to avoid another head injury in a big, long time frame like that, and that's when we get the compounding effects, and that's when our research really runs out on how long it takes to recover.
Do you have any info on, say, like not just a concussion, but a coma, like a really severe brain injury, or a time lapse to recovery on that?
I have I have some research, but not a good summary that I can recall. Yeah.
Now, how do you measure the brain energy?
Oh, let's go back up. No, brain energy levels. This is. I'm gonna get to that a lot. How do we know that we're where we are and if we're back up to here? How do we know that? But how we establish that this is the pattern that happens, and this is a real measurement here, but it's in mice, because to get the brain energy levels to actually measure it, they have to kill the mice. Yeah, so they do it at different time points after concussion. Keep that in mind, because there's how do we determine brain recovery? MRI and CT, they do not show that. They don't show concussion at all, unless things have. They'll show things worse than concussion. So if we determine that there's more going on and we need to send for an MRI or CT, we'll do that to rule out other things like a brain bleed. But MRI, CT scan, no. Symptoms, we know that's not reliable because those can recover faster, okay, on the first concussion. So the best we can do is objective measures, measurements, testing, balance reaction time, cognitive tests, memory, visual processing, strength testing, There's computerized tests that maybe we've heard of those. Has anyone heard of computerized testing, like impact test? Yeah. That is, it's not enough on its own, but if you add up all of these things, then we can determine if the brain is fully recovered and if someone can go back to a risky situation, contact sport, etc. And thus preventing the second impact problem. So, but we have to ensure that the baseline tests correlate well with that metabolic recovery, energy level, metabolic recovery. So the baseline tests that we do are a blast. Everyone has so much fun doing them. It's a bunch of crazy games where you're just testing yourself in different areas, especially when you get a few people together. I had a son and father team just come in and do them together, and that was the most competitive thing I've ever seen. But we test all of these things and all of them together, then we'll have a good test. So if someone comes in, which we're hoping that they do right away after a concussion, then we'll examine them, get a good history, and we'll rule out that there isn't something possibly worse going on, a skull fracture, a brain bleed, cerebellar neurological problems that would need a MRI. If not, then we go on to initial management, which is moderate symptom limited rest. So rest is first, right? But we are no longer treating people like mushrooms when it comes to rest. That's sticking in the dark room for a few weeks and hoping that they grow.
Feed him a bunch of.
Side note, mushrooms can help.
Excellent.
Well, magic
Next up,
and
next one.
reishi.
Yeah, when's the next symposium?
Medicinal mushrooms.
Yeah. So physical and cognitive rest for 3 to 4 days. Okay. Proper education on the healing process and reassurance are the absolute most important treatments at that point, and teaching how to rest, because what is symptom limited rest? Well, it's going for, you know, a couple minutes walk. Maybe you have to have sunglasses on, but you're not going to the point where it starts to get your headache worse, or fatigue, or brain fog, whatever the predominant symptoms are, because it is always different. And then you'll rest and take it easy. Crochet, have a nap. Yeah. And you pretty much structure your day like that. What you wouldn't do is try to go back to work, and the headache gets a bit worse, but you can push through at least to the afternoon, and then come home and you have to crash for however long. And then you need to get groceries, so you go to Walmart, but there's people moving all around all over the place, and then crash, and then you're in bed for 3 days. That's not symptom limited.
Excuse me, were
Yes.
you saying that even if a person didn't get a blow to the head, you can still get symptoms that cause that brain energy to go down again, and so that's jeopardizing your recovery?
Yes, yeah, because of the movement, the quick movement of the brain, even if the head isn't physically contacted.
Liquid blush.
So ideally, perfect world, and it is 85% of the time, we can go through the return to learn, work, play protocol, which is 10 stages or less, depending on maybe we finish earlier if you aren't playing contact sports, we can end it at stage 5. Regular physical activity. But rest stage, once symptoms go away, we can do light cognitive activity, maybe some reading, maybe a bit of schoolwork or paperwork or emails instead of going into work. And if 24 hours goes by and there's no symptoms, you can do a half day of school or work. 24 hours goes by with no symptoms, full day of school or work. Same 24-hour rule every time. If symptoms do come back, you have to repeat the previous stage and then wait another 24 hours to try again. That's a bit fuzzy, but stage 5 is light physical activity, which we would typically run just a walking test at that point and look at heart rate response. And then we get into sport practice, non-contact drills, extreme exertion, full practice and gameplay. So for a moderately active individual, we'd probably be able to end about here. For someone who has no interest in exercise whatsoever, despite us trying really hard to promote that, then once they're back to work, then it really ends here. Most of the end is when it comes to people who are wanting to get back to activities that can cause, where you expect that another head injury is going to occur at some time. That doesn't have to be team sports, it could be skiing, mountain biking, etc. So like I said, 85 to 90% of concussions resolve symptomatically within the 7 to 10 days. Beyond the 4-week period, there's no physiological explanation for post-concussion syndrome or no structural reason that healing shouldn't continue. But as we know, that's not always the case. So can we treat a concussion? Yes. Can we prevent post-concussion syndrome? Most of the time. And then if we look at the other treatment domains that we look at for post-concussion syndrome, I had goosebumps when I was listening to the first couple of talks, because especially Carl, the hierarchy of needs fits all of every step along the way here of what we're working on. And I'm after 7 years of school, the hierarchy of needs completely left me. And so when you brought it back up, it's amazing. So rest first. Now I had these reordered for us today, but I'll just try and highlight. Blood flow abnormalities, number 1. That's oxygen supply to the brain. So we're talking about reasons why concussion symptoms might last longer than that 4-week period. Restricted oxygen to the brain. We heard that in how many talks today? The dura, everything. The vestibular therapy, so that is the inner ear and effect of position, head position, and its communication with the brain. So Carl, you said go upside down. That's exactly right.
Oh, good.
Oh, you thought you were going to get a spanking.
We get way more into that we overcomplicate it to some degree, or it's very easy to, but at the very base of it, it's teaching your body to be able to handle whatever degree of position and movement control that it can, allow symptoms to subside, and do it again. That goes back to that graph that we looked at, and I'll bring it up again. I'm not talking about nutrition at all, but that is one of the 5 major areas, and decreasing inflammation, antioxidant, neuroprotective foods, and that, again, that's come up a bunch of times today. So let's go into oxygen flow delivery, movement, graded exertion. So after the rest phase, if the symptoms are still there, further rest becomes detrimental, right? If you do lock yourself into the dark room for too long, then when you come out, it's a really bright and a really loud and a really scary world. Plus the isolation. So let's talk about the physical aspect. Decreased oxygen supply to the brain. We need cardiovascular exercise. So we find the amount that we can increase our heart rate without the symptoms getting worse. Just a walking test. And then plug it into a little calculation and find the exercise level to work at 6 days a week until that gradually improves and you can do other physical activity. So I'm going to go back to this graph. This one's a little bit different because after 2 weeks or so have passed, if the symptoms didn't go away, we can't just stay in the green zone. We have to push ourselves and pace ourselves and push ourselves and pace ourselves and gradually over time, if we can do that, if we can avoid this one that I did before just with the laser, going into the danger zone and then just constantly crashing, the tolerance isn't going to go up. But if we can do the nice pacing plan or the correct level of exercise, then the tolerance level, the threshold goes up and we can do more and more. So that is turning yourself upside down just far enough and for just long enough, and then taking a rest and then doing it again. Every form of exercise that we go through comes back to sticking to that.
Sorry, if you had a concussion, would you need, after you've gone through that, would you take a new baseline? Like, would your baseline be different?
After you're fully recovered, you would do a new baseline. I think I didn't do a good job of saying how we utilize the baseline. So the baseline test that's done on healthy people, you go through recovery, and then before you are cleared to put yourself voluntarily in a situation where you get another head injury, before you go skiing, before you go back to your sport, you redo the baseline at the very last stage.
And that would be your new standard for future?
That would be your, well, you have to go back to contact, you have to score as well as you did at the beginning. If you didn't score as well, then you go back a stage and you try it again.
I see.
Yeah.
So your baseline does stay the same then?
Yeah. What often happens to me, because we don't get the perfect world where we see people right away. Sometimes I see people at any stage, but quite often I'll see people who've have been stuck for months, right? And at that stage, we get to what we would, if we get to what we would consider full recovery, we don't know. We never know, right? But we could do another baseline. If asymptomatic, fully returned to activities, let's do another baseline at that point. Yeah.
Thank you.
It's really a best guess unless we have one at healthy state.
Can I make a quick comment just about,
Please.
like, when
Yeah,
you're going to that middle, last one, like if
like here?
Like, there.
Yeah.
I imagine, like, with athletes,
Yes.
that they want to give her. Like, I just think, like, that
Yeah.
type of person is like, what? I have to go to, like, this middle area and are go-getters in life.
Yeah.
Like, they just, like, they're like, they want to push through.
Oh yeah.
I think
It's a
that-
price though if you push
Yes,
through.
yes, and then you go into the significant symptoms, and then that's what I'm saying, is like, it seems like that type of person is an athlete, wants to.
Athletes are
Other
the
people.
second, the second worst at being able to stick to this. When I tell them and I explain all this to them, they buy in because this is the way to get back, right? It's people with really stressful jobs usually who can't do it halfway because there's pressure at work and there's performance and there's promotion and there's salary and it's just the way they've always done it is go 100%.
Yes.
Type A plus people.
Yeah.
That's who has the most difficulty
Yes.
being able to do this.
That's what I saw when I saw that graph. I was like, when it went into significant symptoms, I
Yeah.
was like, that's type A or go-getter.
Yeah.
Yeah, just learning how to put the brakes on.
Yeah, and trying to navigate this on their own when all that the physician said was take it easy for 2 weeks. That's where they're going to go. Yeah, and that's how they get stuck. Yeah.
Hey,
Yes.
kind of
Okay.
Sorry.
It's okay. Questions are good. Yeah. So number 1, increased blood flow, exercise, proper levels. Number 2, cervical spine. Whiplash happens with every single concussion. There's never been a concussion that didn't have a whiplash. To some degree, it takes 96.1 Gs of force, gravitational units, to cause a concussion.
wow.
It takes about 4.5 to strain the neck muscles. Yeah. Here's a nice graphic that shows the overlap between concussion symptoms and chronic whiplash symptoms. And then I did mention a little bit about specific visual and vestibular rehab that has to happen. That's, again, graded exercise, improve eye muscles, balance system, postural control, neck movements all together. Okay, but that gets all my important points of education and reassurance is the most important thing right away. Education being even just those graphs that I showed you. Moderate rest at the initial stage, but becomes detrimental around 2 weeks. Follow-up, return to play, and learn and work processes monitored and followed by knowledgeable practitioners. Symptoms are poor indicators of recovery, and we can prevent and treat post-concussion. Thank you.
Thank you all again for being patient. I know we're going well over time here. We do have one more presenter. And before we get there, I just want to give big gratitude to the space and to Catherine Greiber and everybody else here at Title Elements. They offered this space up for us to make this event possible, and let's give them some big gratitude. Also, big gratitude to all of our presenters. They are all here on a volunteer basis. They volunteered their time to not only present their presentations, but to prepare their presentations. I don't know how much time any of them took, but it does take time to put something together to make a presentation like this. So big gratitude to those guys. We are doing this as a non-profit event. There's no profit being made here. It's free for everybody to attend because we feel that this information should be free. You shouldn't have to pay to learn about what types of treatments are available for you. So here you are. That being said, it does cost a little bit of money to organize some things, things like printing and other various promotional costs. So what I did is I went and got some of these buttons, and there are several of them. This one says, "Someone I love has a traumatic brain injury." This one says, "June is Brain Injury Awareness Month." "I wear green for my child." TBI awareness. "Please be patient, I had a TBI." And they're available at the desk there, and they will be available at the front desk in Title Elements for the month of June, because it is Brain Injury Awareness Month. And all of these amazing treatment options that are available to us, they all cost money. It's unfortunate, but it's reality. Everybody needs to pay bills to live, and so we're gonna find, now I get to introduce to you somebody who can possibly make some of these treatments more affordable and available to you. So let's bring up Tara Hogan of the Neurological Wellness Association.
So I'm Tara, thank you. I had a presentation, but I'm going to skip it just to have a chat because we watched lots. I want to thank everybody for having us here. I'm here with my colleague Lena at the back who works with me on my team. And just because it's dark, we didn't come all the way in with her brother who's with her from Victoria, but we'll be here to answer questions. I want to share with you the interesting story of how life works before I tell you a little bit about the Neurological Wellness Association. My background is in business and human resources, and 15 years ago I wasn't quite where I wanted to be, and I left my corporate career and I became a massage therapist in Alberta. So don't hold it against me, I am an Albertan transplant. But I've been working in the Okanagan, Shuswap from Salmon Arm to Kelowna for the last 3 years. I'm a manual osteopath and manual therapist. And so I followed my heart into where I really should have been when I was much younger. And I work with clients in manual therapies. The second part that's interesting about all of these other practitioners, because as a practitioner I should have some of these answers. But I was in a car accident last year and am recovering from a concussion that wasn't defined by the medical world until 6 months after my injury. They decided I had a concussion and whiplash. So the challenge is that we live in a day and age where other therapies outside of the medical system that we're familiar with, which is great and has lots of benefits, doesn't bring always what we need. And so as a holistic or alternative practitioner, I joined as a practitioner the Neurological Wellness Association. And the NWA came about in 2010. The founder, Eric Hallstrom, his mom had a neurological disorder. When he was trying to support her, he couldn't find practitioners, he couldn't find therapies outside of what was medically approved to support his mom. We are now 2020, we're down the road a bunch of years. We are an organization that works to help individuals across Canada of all walks in life to access services. And that's defined differently. We're here talking about brain injuries, and when he created the organization, it was called the Neurological Wellness Association because of his mom's condition. But we help people because everybody's individual wellness goals, health goals are different, whether you're young, whether you're older, whether you're recovering from something chronic, you're recovering from something specific, or you just have general wellness and you're active and work full time, you want general wellness. The Neurological Association, also known as Wellness Association, works with individuals in a number of different ways. So we are a nonprofit organization. One of the ways that I work as the health coordinator for Canada is that I bring people like myself and the practitioners you've listened to today, and Untitled Elements, who's one of our practitioners in the area. We bring you together with people in your region who can provide services to you. Some of those members offer preferred rates for services to members. We also, and just to wrap how we got here, because Steve is how we got here, through our organization. That's why I'm talking about the universe, putting you all in the right place. Steve found us, however he found us, and ended up talking to Lena and said, well, here's what I'm doing in Vernon. Why don't you guys come? And I recently relocated back to Kelowna from Salmon Arm. So that's how I ended up being here, because I'm local. But the universe puts you in the right place in terms of finding who you are and what you need. And when Eric created the organization, he found a couple of things. Practitioners wanted to work, people wanted services, but they couldn't always find each other. The second problem, as Steve said, sometimes is that everything costs money. We all are here to earn a living. We have expenses when we're in chronic conditions or recovering. Maybe we're not working full time. We can't afford some of those treatments that aren't typically covered by provincial plans and health benefit plans. And in this day and age, not everybody has access to those plans because we don't all work full time and many employers are no longer providing them as benefits. So we offer some of these services, and we also have different funding mechanisms that allow individuals. Every Canadian has access to this service with us. We have other programs that we offer in terms of providing health benefits, and our practitioners work from very traditional, physio, chiro, massage therapy, counseling, emotional counseling, psychotherapy, all of those traditional, to the other extreme where we have light therapy, energy workers, we have manual therapy. In BC, we have a lot of holistic therapies compared to some of the other provinces. Some of our practitioners fall under different associations. Some of them work in fields that are not yet regulated by associations or colleges. But what we do is we work to bring all those practitioners together so that you have a network to be able to access individuals. Steve has reached out to us and brought us together with some of these individuals and practitioners. And what I would encourage you to do, and Lena and I will be here today, is to talk to us about how we might be able to help you or your family, or even to find out what's here in Vernon. We have quite a number of practitioners in the Okanagan Shuswap region, through to Kamloops, Hope, and right through to the coast. And our biggest network, of course, because Eric was in BC and whereas we started, is here. But we have expanded all the way across the country. So if you have family members that reside in other provinces, just because they're not here and we are, I work with people from every different province, and so we can connect you with practitioners in those areas. And what's interesting, because I know some of the practitioners say, I don't remember who, but some others are from Kamloops and Kelowna, I mean. Someone I know works in Salmon Arms. So many practitioners work virtually in this day and age. They work in multiple locations. They will do on-site events much like this. They'll do open houses. They'll come to group events as well. So it doesn't mean in this day and age that you have to be with your practitioner in your city. So we have a lot of different ways that we can reach out and access and provide services. Does anybody have any questions for me about what we do with NWA and how we might help you?
With inquiries, do we just email you?
You can email me. I put some postcards at the back. You can email me. We're on social media on Facebook. We also have a website, wellnessassociation.org. I did bring forms if people want to become members. I did bring forms. I didn't put them out yet, but I'm happy to leave them here with title elements if they're open to that. They can connect and get them to me, and I drive this highway a lot, so I can always stop in and pick them up. But that's a great question. Anything else?
So one of the things I just want to mention as well is when you get a practitioner membership, you also get a wellness membership with us, which means even as a practitioner and maybe, everything's going smoothly, universe willing, but you would like to access supports as well, so you get the same access that any of our other wellness members do. And so if you come across a practitioner that you want to work with, and again, the money is an issue, then you go onto the site and you can do in a subsidy request form, and we'll do the fundraising on your behalf, depending on, we'll work together as to how much of that will be. But part of our passion is to make sure that everybody has access to the supports and services they need to move their wellness journey forward. And that's one of my favorite things about what we do.
I just want to say, people ask me all the time, and I hear this, and I know even as practitioners you'll hear this with people telling you the benefits of their treatments. What we do, and I got involved with this organization because I wanted to help more clients. But I'm a manual therapist, and my body will only go so long. So working with the association is another way for me to help people. This organization was designed to help people access services. And when we provide funding to someone, whether that, and we funded, just to give you an idea, we funded from a $25 yoga session in Halifax to we're currently raising funds for someone who's looking for a service dog, which can be upwards of $35,000 plus ongoing care for their child. So think about all the different therapies in there. When we say, yes, we're going to help you access a treatment of light therapy or physio or chiro or whatever it is, that might be a portion of that treatment. It might be most of that treatment. And our goal is to help you access those services so you can get back to the things that you want to do. And what happens is that those people then call me and say, this is too good to be true, Terry. Are you really doing that? Are you really helping me? Yes, we really are. And then what happens is those people come back and say, how do I help you tell more people about what you do? And they become people like Lena, who comes to work with me and give back her time, or other practitioners who do events like this. Because ideally, where we are in our health journey, some of us do struggle with chronic conditions, but if I can help you get back to work so that you can support your family and all the emotional and support and things that go with that, then we've helped you. And sometimes what happens in the beginning is we provide a lot of support. And then that changes as you get back on your feet. We provide less and less, and you're able to get back to work in whatever capacity that was, and back to your life and the things that are important. So thank you to Steve for the universe putting us all together and for having us here. I'm happy to chat about what we do with the organization, and as well, because I've heard the word osteopathy, which is all part of where this comes from, I'm happy to talk about how this fits, because even as a practitioner, I've enjoyed listening and learning into all the different pieces, because it's a journey for everybody. So thank you, and thank you for your patience for being here. Please.
Thank you, Tara. So yeah, these buttons are available by donation over there. If you guys want to support the event a little bit, that would be fantastic. Anything surplus, I think it would be appropriate to donate it to a cause like the Neurological Wellness Association, so that they can provide us with the kind of support that we need. I'm going to close by saying that there are a wide variety of other services available here in Tidal Elements. One of them is the a float tank. If anybody has ever heard of floating, has anybody tried any flotation therapy? It's very relaxing, it's very nice. I really want to try it in conjunction with Cranio-Sacral therapy. I want to do them together if possible. I think that would be really cool. We have someone here, I can't remember your name.
Christopher.
Christopher is available to give you guys a tour if you guys would like to go and check out the tank that they have here. I'm going to play one more song and that will conclude our event. Please reach out to any of the practitioners that really reached out, that spoke to you, to your heart. And thank you again for enduring our power outage, this heat, and my rambling. Une étoile, c'est la lumière pour la nuit ce soir. Une étoile, c'est tout ce qu'on a besoin. Un poisson, c'est tout ce qu'on a à manger ce soir. Un poisson, c'est tout ce qu'on a besoin. Quand tu vois le monde dehors, quand tu vois le monde dehors, quand tu vois, on a tout ce qu'on a besoin. Et c'est beaucoup pour tout le monde. On a tout ce qu'on a besoin. Et c'est beaucoup pour tout le monde. In English. A star is the light for the night tonight. And that one star, well, that's all that we need. And a fish, that's all we have to eat tonight. Well, that one fish, that's all that we need. And when you look to the world out there, quand tu vois le monde dehors, quand tu vois, on a tout ce qu'on a besoin. Et c'est beaucoup pour tout le monde. We have all that we could need, and there's plenty for all of us. Dans la terre, de la terre, dans la terre, de la terre, dans la terre, de la terre, dans la terre, de la terre. On a tout ce que nous pouvons vouloir. From the earth and of the earth, we have all that we could possibly want. So let's take good care of her and ourselves. Quand tu vois le monde dehors, quand tu vois, quand tu vois, quand tu vois le monde dehors, quand tu vois, on a tout ce qu'on a besoin, et c'est beaucoup pour tout le monde. On a tout ce qu'on a besoin, et c'est beaucoup pour tout le monde. We have all that we could need, and there's plenty for all